want to give a thank you to Bircham Hills, who's our presenting sponsor for the Senior Health Series this year. You may have noticed the snacks in the back. The chef there tried to, he's so creative. He prepared an antioxidant-rich blend of walnuts, dried fruits, dark chocolates, and pepitas. So I hope that you enjoy the little granola trail mix bags. Today's installment, our third program in the Senior Health Series of Understanding Chronic Conditions, deals more with the cancer focus. So a focus more on cancer coping strategies, kind of just whether you're here for yourself, for a family member, a loved one, a close friend. I know that you'll be able to take a few things away from our presenters. We have Debra Batterbee, who's one of the oncology nurse navigators here at Sparrow, and Amy Waddell, who's one of the social workers here with us, Herbert-Herman Cancer Center. So very excited to be able to welcome them today. We're going to go ahead and turn it over to them. We'd like to hold questions again at the end, so we're going to have them present, and then if you don't mind jotting down your questions on the notes sections there, and then we'll have the presenters say the questions, that way everyone can hear them. Thank you again for joining us today, and please join me in welcoming our Sparrow Herbert-Herman Cancer team.
Thank you. Thank you everybody for showing up today on this hot Tuesday. I feel like I'm melting up here still. But my name is Amy Waddell. I am the oncology social worker at the Herbert-Herman Sparrow Cancer Center. I've been practicing oncology social work at Sparrow for 6 years. Prior to that, I was at Henry Ford Hospital in Detroit, where I did oncology social work for 10 years. So I've been working in oncology for about 16 years. I'm happy to be here today, and hopefully you'll find this talk helpful.
Thanks, Amy. And I'm Deb Batterbee. I'm one of the oncology nurse navigators at the Cancer Center. We actually have 3 navigators right now. I work primarily in the genitourinary area, a lot of prostate, bladder, kidney cancers. We've got oncology navigators in the breast cancer area, as well as colorectal, lung or chest, and upper GI. And colorectal. So we've got kind of a mix of navigators that are covering kind of those cancers that are the highest volumes, so affecting the most number of patients, as well as some of those that have some of the highest needs or require some multidisciplinary involvement from many of us. So anyway, so what, and I've been at the Cancer Center since about 2013, I think, is where I came in. I'm actually a certified clinical nurse specialist, so after my graduate school I came over to the Cancer Center and joined oncology then. So we do have a quick question before we start today, just as a little bit about us in terms of who's here as well. Just wondering from the perspective of who's here in the room, has anyone, and only to share if you're so inclined or desire not, but wondering, anyone here a current cancer patient or cancer survivor? Phew. How about someone who's had a loved one, be it a spouse, a child, a close family member who's had cancer?
Okay.
And how about just here to learn a little bit more, don't really know anyone, but just kind of looking to be maybe supportive, somebody from your church or community or neighborhoods? So, and you'll see there's a nice mix of people here. We've all had some experience with cancer, whether it's been in your personal role yourself, or as a friend, as a family member, as a caregiver. And so I think there's a lot of takeaway for that. And that's part of what we want to talk today, is about the fact that cancer isn't just about the cancer patient. So we're going to talk a little bit, and that's what we're going to do. We're going to let Amy start.
Ooh,
oh, no, we're going to start there.
Back one.
Oh, because you went to
Okay, yeah.
Okay.
I've got one slide to present before we get started. So anyway, great question. I'm glad we've got like a good representation of people here today that have both had their personal experience with cancer or family members. So hopefully you'll find this talk pretty helpful. So today, it's cancer and coping strategies. And this is near and dear to my heart, because I truly believe, and you guys hopefully may agree with me, that coping is at the heart of the cancer experience. It's at the very heart of it. It is the experience. Outside of how we cope and how we deal with our emotions is related to a cancer diagnosis or those of a loved one, the treatment is medication, chemotherapy, radiation, surgery, side effects. But getting to how you process your emotions and how you make your way emotionally through this whole process is just so incredibly important. Just earlier today, I was talking with a patient and we were talking about coping, and she said, if there was a pill that I could take to help me cope with this, I would do it. I would take it any amount, I would pay any amount. But it's the emotional part of the experience that people usually struggle with. And so that's why it's an important topic. So coping requires emotional stamina because treatment can go on for a little while. So it involves us knowing our own coping styles, how we naturally cope with things, how we integrate new ways of coping into our repertoire. And it's usually a very intentional type of task. You know, like we have to put some focus on that, whether we're working through it ourselves or working with it through people that we love. And so today we're going to look at how people deal with fear and uncertainty, which is what a cancer diagnosis usually brings about. When as people, we like most peace and predictability, and cancer kind of takes us out of that seat for a moment and puts this fear in. So we're gonna look at fear and uncertainty and how patients and families negotiate that. And then we're gonna look at our own personality styles and the various ways that we find to cope and how to integrate new ideas. So that's what we'll talk about today. Next slide, and let me give it to you for the chronic condition.
So what we thought in terms of the series being Understanding Chronic Conditions, we thought we would give a couple of definitions for you in terms of why did we actually think when Katie called and said would we come talk with her, she kind of said, would you come talk and what would you like to talk about? And that's where we kind of had to come up with what we thought may be interesting to you. But when we look at, chronic conditions, defining cancer as a chronic condition, for some people is kind of a new thought. We think of things like high blood pressure and diabetes, even depression and things like that as chronic conditions. But as cancer, when you define cancer itself, cancer is a disease caused by uncontrolled division of abnormal cells in the body. So that is a very medical, physiologic process that's happening. But what makes it chronic, we looked at the Centers for Disease Control, and just as one of the references, chronic diseases are defined broadly as conditions that last 1 year or more and require ongoing medical attention or limit activities of daily living or both. Well, when you look at that as, well, what is a chronic condition? Amy and I both looked at this and said, well, good gosh, cancer is definitely a chronic condition. Many of our cancers, even in the best case scenario, last more than a year. The treatment part, maybe. The recovery part, for sure. Mm-hmm. Then we look at more serious cases, more complex cases, and for many people it goes on to many years. So it seemed to fit very well in the terms of calling cancer a chronic condition. But then chronic condition number 2 being coping. Coping is actually in and of itself, coping with cancer is a condition as well too. Well, what is coping? Coping is what people do to try to minimize stress, commonly seen in health psychology as a problem-focused, or that is directed at reducing the threats and losses of the illness, or emotion-focused, namely trying to reduce the negative emotional consequences. Well, that certainly looks like something that we deal with on a daily basis. Anything from an initial diagnosis all the way through the planning of treatment, the treatment itself, recovering from treatment, and the long-term implications in care on both patients and families. So we're going to talk about some of those, but we want to sort of define it as cancer as the chronic condition as the disease process, but that the coping is also a chronic condition with its own set of treatments and own set of problems that come along. So, all right.
Okay, this is my favorite slide. So, this is how every cancer experience starts. I'm minding my own business. And now Deb could speak to this. When we have treatment rounds, oftentimes when the doctors are introducing a new patient, the patient isn't there, but just to the whole staff, they'll say, well, Amy Waddell was minding her own business and then she got a mammogram. I think this is really important to keep in mind because remember I said peace and predictability, that's what we like. Everything's in order, we feel like we have some control. We're literally minding our own business, and then what happens is a concern. So I'll give that to you.
So we're concerned. We find a lump, a bump. We have some sort of lab test or imaging study that's done. We get a test result back. The doctor calls back and says, we have something that we've seen. We need to do a little further investigation. We're not necessarily thinking cancer. No one is necessarily, sometimes, thinking cancer. What's your reaction to that? We start right out of the gate. We don't even have a cancer diagnosis yet, but there's a stress piece that kicks in with something was abnormal, and what could that mean? Personally, you may run into like, oh, this happens all the time. It'll be fine. Or others are, oh no, my mother had breast cancer. My mother died of breast cancer. I must have breast cancer. I'm going to die of breast cancer. And we've gone the whole way from that screening mammogram in one phone call to we've died. And so for some, this also may be, we'll use the breast cancer diagnosis or the breast cancer mammogram, and it may be, oh, I've had cysts before, I've had lots of biopsies, this is no big deal. And so it's very individual, not only for the patient, but also for the staff to really understand in terms of where you're coming from. So right away, our personality types and our coping styles kick in to help us prepare ourselves for what kind of outcome does this finding mean.
In the event it is cancer, that's what we kind of get prepared for. So then comes the diagnosis, the confirmation, it is cancer. This is what we're dealing with. So now, there we go. That's pretty much kind of how we feel. I thought that was the right emoji for this slide. Whether somebody is externally kind of emoting that way, like behaving that way, or if they're much more internally just kind of feeling that way, that tends to be the feeling. To get diagnosed with cancer is a pretty traumatic event. When you talk to someone who's received a cancer diagnosis in the past, they can usually be able to recall at least parts of the conversation in detail, and then sometimes things go a little bit fuzzy. So it's traumatic, as some people can sometimes feel panic, go in shutdown mode. So there's all different kinds of ways that we naturally respond, but certainly the shock of the diagnosis is one that doesn't wear off quickly. So the diagnosis starts taxing our ability to cope or regulating our emotions. So it's going to take some time to kind of come to terms with what this means as you're talking to the doctors and getting clarification. You may be thinking about, first thought might be, who am I going to tell? Who am I going to have to tell? How am I going to tell them this? When you yourself, all you know is that you've got a confirmation of a cancer diagnosis, but outside of that, you don't know much more. Now, the bad news about this is the next slide. This right here. This period after getting diagnosis can take some time. You get a pathology back and they will say, yes, it confirm it's cancer, but there's a lot of things that they don't know. We need to run this test or this test or this test. And the good news is you have time to process it emotionally. The bad news is you have time to process it emotionally. It's just it's a lot of time. We put a fact up there about average time from diagnosis to actual treatment, 21 to 62 days. That's the average. When people usually get a cancer diagnosis, they would like treatment to start the same day, please, now. And it just virtually never goes that way. There's another thing that doctors refer to called the 2-week rule. And the 2-week rule is if you see one doctor and they want you to, Dr. A wants you to see Dr. B, that takes about 2 weeks to get to see Dr. B. And so that can extend the time too. So it can be a pretty emotionally difficult time when we're dealing with diagnosis, waiting for clarification. You're getting updates all the time, and family and friends are asking for updates all the time. Point being of all of this, people can feel pretty emotionally fried just even sometimes before they start their treatment, just because they've been dealing with this emotional fallout for some time.
And I'm going to add a little bit onto that, because part of what I do as a role as a navigator are those days between that diagnosis and when that treatment starts. And so many phone calls or referrals come our way to say, I've got somebody who literally, what I get is the pathology report. Well, that's the same thing now that you can see on your My Sparrow account. And fortunately or unfortunately, some of the recent changes that have come through are the minute the pathologist signs that report and says it's cancer, it dumps a message into your My Sparrow account and says, you have a new message. Guess what? You have cancer. And so the days of kind of waiting for your doctor's phone call to come can happen, but it also can pop up as a message that says, I've got some new information for you, and that can be distressing for people. And so then a phone call might come in to say, I just saw my pathology report and I don't know what that means. And that's where it's very important to have somebody for you to be able to call and to touch base with, because that panic mode has already hit. You know, and it literally might be, I had a biopsy done yesterday. And so I think an important piece of that is having someone to be able to help drive and facilitate what are our next steps. Tell me, what does this mean? What information do I want to collect? Or I'm somebody who wants to read about this on the internet. I always say, don't call Dr. Google, because Dr. Google can send you down a lot of roads. Some of them are okay, and some of them are a lot of misinformation. And so just having someone to talk with you or a spouse or a family member to be able to say, let's get you some information, let's get you on the right track of where to go, or mail you some information. Sometimes just a matter of, I know that you've got the same diagnosis, here's what we need to do. It's my job to make those tests that Amy referred to not take 2 or 3 weeks, but if I know you need to have an MRI, let's get it authorized with insurance as fast as we can, let's get it scheduled as fast as we can, and our goal is always to get those tests done before we see you, because to come to a visit, especially your first visit, you really are walking out wanting to say, tell me what I have and tell me what I need to do. And so there's a fine line between coming to talk right away as soon as we know the words cancer and getting all the information, because what you really want to know is, what stage is this, what kind of treatment do I need, what's involved, you know, all those unknowns that cause all of that stress. So one of the coping mechanisms that we actually have built into our program is to have navigators. I've actually got Amy, we work super close together to be able to connect even before your first appointment. Somebody has a first appointment and has no way to have a ride to get there. There's an immediate phone call to Amy to say, what can we do to try to help out to get somebody to those appointments, knock down those barriers from the beginning. So I just kind of like to kind of pull that in to be able to say all those things that are happening so quickly. It can happen very slowly, and it can happen a little faster, just depending on what resources we tap into.
Mm-hmm.
So,
And then there's, you know, what also is an aside, if people are admitted into the hospital and a cancer diagnosis happens during someone's admission, things tend to run quite a bit quicker than they do.
or a little
versus
differently.
differently and more quickly. So now we get to the treatment. So this has been anticipated, and people are usually relatively relieved to just be starting in treatment, because there's been so much anticipation about it. When it comes to treatment, thankfully, is defined very much by action. Like, what is my role going to be? Either as the patient, when do I need to show up? What kind of medications do I need to take? What do I need to get educated on? Who in my life is going to drive me in for treatments? Who is going to procure the things that I need at home? Food, toilet paper, if I need that extra help. So there tends to be a flurry of activity during treatment that is refreshing because it's action-based. At the same time, you're also in the midst of treatment, so maybe you're not feeling as good. So you're learning along the way what kind of help you're going to actually need, because it's gone from just a concept into like real life. So it can certainly be a busy time when it comes to supporting the person that has cancer. If you're more in the friend or family role, this is a time where you tend to get pretty active, delivering meals or whatever it is. But many people will say through their cancer journey, they may notice at the beginning of their treatment where there's lots of people interested, cards, letters, phone calls, and lasagnas. After months and months of treatment, it kind of becomes old hat, and then you have to kind of dig into like your next layer of resource. But as a person supporting someone that has cancer, being able to play the long game is awfully important, rather than just the upfront stuff. So that's what I get reported back from patients that we see, that we treat.
And adding on to that, I think as either the cancer patient or the family member or the friend, to be able to not feel bad, to be able to ask for help, or to say, I've got a little too much help, I need everybody to back off a little bit, I'm kind of drowning in this right now. And we sometimes kind of float back and forth between the two of, I need more help, now I've got so many people around and so many people calling and checking on me that's exhausting as well too. Sometimes there are children in the house, there are grandchildren, there are maybe family members who live a ways away. And so finding ways to be able to communicate or get some of those group messages, having a spokesman and things like that, so that you're not having to make all the phone calls or arranging things. And some prefer to keep cancer very private. I have a close friend who dealt with cancer for a number of years and really didn't want to talk outside of a close circle of friends, didn't want everybody to know the details, didn't want the sick role as a young person. So it was better to kind of deny it and not let everybody know that we desperately needed some help. And so sometimes that's where having those who know us be able to not feel bad to ask or to just kind of suggest. They could really use something like this. They could really use that, and have it just kind of show up on the front porch sometimes was nice without having to ask. So I think it is a fine line. We see a lot of it of that between the desperation of I have so many things that I need, I don't want to be a bother, or in that long haul, all of the help kind of goes away and nobody really wants to ask and say, right now our insurance ran out because we had it through the employer, and now I'm on long-term disability and I'm lost insurance, and now my co-pays are getting higher, and so, picking between food and medicine starts to come into play. We see those things, but you're not likely just out there sharing it with your next door neighbors, So I think those are the things to kind of just as we're neighbors and family members to kind of be aware of, how are we doing? How are you doing with not just the doctor visits, but emotionally and just household things, and that is a good thing to keep in mind. So, all right.
Okay.
You want to do this one or me?
I don't care.
You can start with that one. Go ahead.
Okay. Behind the scenes. So we're back to the coping now. So we've gone through the concern, the diagnosis, the treatment. So what's going on emotionally within the patient who has cancer or the family? So I actually put something down here. Patients respond in different ways to their diagnosis, the initial medical workup, subsequent test results, and the implications of all that is happening to them. Many patients respond by leaning into old coping skills and old patterns of coping. This is what I think is kind of critical to understand, and what we're going to get to next is being able to identify of these different coping styles that are listed up here, kind of which one you may find yourself falling into most naturally. Because when we've got the fear and uncertainty and we're dealing with something different, relatively traumatic, we tend to kind of go to the old ways, the ways that we just know have always worked. So the coping skills up here are depressive, active, distractive, faith-based, and minimizing. And we're going to spend the next few slides going through each one of those to kind of see, does this naturally sound like me or someone I know? So let's go. Okay, depressive. Here we go. As we would assume, withdrawing from others, checking out emotionally, pitying oneself, brooding. Is that your natural way of coping? Not that there's anything wrong with that. I mean, if it's your sole and only coping skill, we may be challenged a little bit. But I mean, certainly this is a free expression of feeling. Sadness requires tears, and it's okay. But someone with a depressive coping style might find themselves sleeping more, pulling away from people, not really want to participate in anything that they used to maybe find fun before. They may cancel plans. They may shy away from communicating with people. So this is one way that people find initially just to kind of, I don't know, kind of hole up and try to process their thoughts and feelings is through just some depressive kind of methods of coping. Active coping. So active coping, people would think of maybe as a little bit more adaptive or maybe a little bit more positive than depressive coping. So this is things like seeking information, Dr. Google, unfortunately, sometimes, doing a lot of research, doing a lot of reading, problem solving, and deciding to fight, to actively fight. This kind of person is going to want to mobilize their resources. They're going to want to learn everything there is to know about prostate cancer and what to look for so they can understand what the doctor is saying in the doctor's language. They're going to engage in problem-solving efforts. If there's anything related to treatment, they need a ride, whatever it is, they're going to be dealing with that. They're going to read up, and they're kind of strongly motivated to know what it is that they're facing. The research has shown that an active coping style is definitely like a very adaptive way to deal with a diagnosis. Let's go to the next one.
Okay, want me to do that one?
Sure.
So our next one is kind of distraction coping. So for some, and this is where I kind of say, how many of you are, if you get stressed, do you eat? Anybody eat? Anybody like to exercise? Go read a book or turn on the TV.
That's it, Netflix.
That's like it, yeah. I mean, those kind of things are definitely out there. So distraction coping is part of that. You're encouraging yourself, and sometimes it is seeking success in another area. It's distancing yourself from the situation, to just get out and go for a walk the dog, go to the store, go grocery shopping, clean your house. Those kinds of things, you know, are to distance or divert oneself from the disease. I don't want to think about it right now, so I'm going to really get into work, go out with friends, throw myself into one of my hobbies. Maybe focus on an area where you're actually in control of it. I chuckle with my mom. I always say, this is her cleaning and laundry mode. You know, if she's stressed, she's got the laundry machine going, washing curtains that didn't need to be washed, you know. But it's those kinds of things that we do that don't necessarily, we don't spend a lot of time talking about it. It's a distraction to kind of not necessarily avoid it, not necessarily deny it, but our mechanism to be able to move on and continue and retain control and normalcy.
Yeah. As Deb was talking, I was thinking about back to when you were talking about not everybody is the kind of person that's going to be real communicative about their disease, and they're not just going to talk with anybody about cancer. I think there's a real place for distraction, honestly, in a very, very healthy way. Anytime your life is out of balance because of one thing, everything's going to feel out of sorts and off. So with every person that you come in contact with, or every social media contact that you might have, has to be about cancer, it's going to be a really tough way to live. So I think there's a real healthy component to having a little bit of distance while your mind absorbs and your body absorbs the news. So, yeah, I just wanted to say
That's
that.
right. So one of the other ways are religious or faith-based coping. And, for some people, this is accepting this as a fate, if this was intended or God's plan for me. Others search for meaning in terms of why did this happen? Is there a reason that I got this? Am I supposed to take something out of this? For some, does it feel like a punishment? So lots of different, it's a time where sometimes people are really immersed in their faith and drawn closer to their faith. And for others, it is a time where they question their faith. And so we really find, and for many, we find a little bit of both of that happens, and that comes in phases as well too. But there can be comfort from that and drawing on faith families. There can be a sense of inner peace and inner strength that comes with that in terms of knowing it is not in my hands, and being in greater hands. Finding meaning in terms of and value that transcends your individual existence. Many times we do feel people with a cancer diagnosis really is a time for introspection and looking at our lives. And some people with a cancer diagnosis really have a positive transition to their life and really setting things straight, having conversations that maybe are long overdue, and for others they can very much distance themselves. So,
Had a patient experience the other day. It was husband and wife. It was the husband that was dealing with cancer, and he defined himself as a very spiritual and faithful person. God was a very important figure in his life. He had a good understanding of that, and he was really comfortable with that. His wife, not as much. And so what he really wanted from me and from us was to help her come to terms in terms she can understand with. He is quite ill. And so it's because even though within the same couple you can have two completely different coping skills, but he was very ready to have the conversations about what happens next and end of life. He wanted us to be sure that he was not fearful of those discussions at all, and really needed some help just getting his wife along with him on the same page. So certainly faith and belief is a huge for so many of our patients and incredibly important.
and following on that, I think one of the things that we find to be very valuable in our roles are when people approach us to be able to say, I would like your assistance with my family. And so many of those are the communicating of, I'd like to have this difficult conversation, but if I bring it up, my family, my kids, my spouses aren't in the same place that I'm at. When we've got someone who feels that we're a safe contact to be able to say, help facilitate those conversations. And it may be the patient and it may be the spouse or child who says, I don't think we're on the same page. Can we have some more candid conversations? We have a very valuable role to be able to help facilitate those conversations, to say maybe you'd like to bring it up, but your partner does not want to bring it up yet. Then maybe the thing is for us to, as the providers, to bring up the conversation, and it sparks additional conversation once you go home again. So I think part of that is just the ability to be able to say, please do talk with your providers, and it's okay to even, put a phone call out and be able to say, hey, at the next visit, can somebody bring this up? Here's something we really need to talk about at home. Those are the kind of things that can be super helpful. So, okay. You want to do minimizing?
Minimizing, I know when I first looked at this, I thought, minimizing, not so good. But really actually, when we're talking about minimizing a problem, we're talking about denying a problem. I think to a certain extent, this is the brain's way of kind of cushioning the impact of something like a cancer diagnosis that might be like a fearful experience. It is really unusual, really, really, really unusual that someone stays in denial over the long haul. I've talked to many patients who will say, I haven't cried yet, so I'm worried about, am I in denial of all of this? And I always say, no, you're not in denial because you're here. You showed up. People that are really in denial are actually not even going to come to the doctor or have a follow-up appointment or anything like that or do treatment. But kind of denying a problem initially, I think, like I said, it gives us some cushioning of the impact of a diagnosis and the fallout. I think that minimizing along with depressive coping style that we mentioned at the first, those are two different natural ways of coping that probably could benefit from, a few other healthy ways of more adaptive coping. Next slide. So this right here is the social worker in the cancer center. This is near and dear to my heart. What they call monitoring distress for a patient that has cancer. You know how you've been to the doctor and they'll ask you about something like pain typically, and they'll say rate your pain on a scale of 0 to 10. This is the exact same thing, this part right here, obviously, 0 to 10, but not physical pain, emotionally. How do you feel that you're doing? So we have every patient that comes through the cancer center towards the very, very beginning of their treatment, when some of their first appointments, we have them fill this page out. This is very informative, actually. In this, how people rate themselves as far as distress, it challenges sometimes even our own assumptions about what someone's stress level is going to be. Because it's not someone's disease, like let's say if they have a very advanced disease or maybe kind of a dire, unfavorable outcome, doesn't mean that this person is going to rate 10. It can very frequently happen that someone comes in with a disease that is not easily curable, or the doctors might say things don't look really good, but they are kind of at the term or the place where they might register their distress down here. So it doesn't always match up with what a diagnosis is, either at the cancer center or in real life. But this gives us a guide for a patient to be able to tell us kind of how they're doing emotionally and how much help they need. On this side of the tool, they have people actually put in what exactly is it that's like bothering them, that's causing the distress. And you'll notice some of it could just be very practical things. Like financially, I don't know how I'm going to float this whole cancer diagnosis. I'm worried about work, and am I going to be able to work during treatment? I don't have a ride. I mean, that one comes up a lot because there's so many appointments that you have to make at the cancer center. And then family problems. You would probably not be surprised to know how often these things are filled out like, yes, I'm concerned about my family, I'm concerned about my kids. And then emotional, depression, fear, nervousness, sadness, worry, loss of interest in activity, or spiritual or religious concerns. So I look most closely at this and where someone kind of subjectively rates their distress, and then over here to see what needs to be discussed or talked about to work through these issues. So the thing that's nice about this tool is it's the first time that we're actually not telling a patient what we're going to do or what's wrong, but we're asking them to tell us what's going on with you. So I think it's an incredibly valuable tool.
And adding on that, one of the things that I see that sometimes, I don't know if surprises me is the right word anymore, but I'll see distress scores come in quite high, and a common one that I see come in with a high distress score is family health concerns. And I deal with a lot of patients who are in their 70s and such, and I see a lot that have elderly parents still alive. You know, this past week I had someone again, mom just fell, she broke her hip, she's in a nursing home, and totally, I think I'm not going to treat my cancer right now because I'm having to deal with what to do with mom. And those kinds of things are just a reality of life that, you know, the financial and the ride is a piece, but it isn't just someone who needs childcare at home. Sometimes it's literally caring for parents and having to choose between one or the other that you see. And sometimes that distress is anticipatory. How will this affect my relationship? You know, so it's everybody is so individualized with it. You're right. You can literally just have no idea what kind of number you're going to see. Someone seems very distressed when you're on the phone scheduling appointments, and by the time they get there, we've given them a lot of here's what's going to happen next, here's some information, do some reading, and by the time they arrive, we've kind of moved out of that 8, 9, 10 panic mode down to a much lower level. Sometimes I even see that if we took this at the beginning of an appointment or at the end of an appointment, that number changes dramatically.
That's what I was going to say. This is a snapshot into our lives. Only as good as the day and the time
Yeah.
that you have someone fill this out. It is ever changing and evolving, as you know, right?
And what really also sometimes I find is who fills out the paperwork. Because how many of you, the new patient paperwork arrives, somebody fills out the paperwork and, oh, my wife filled that out for me. You know, and the numbers aren't necessarily reflective too, so that's something we see.
Yes.
All right, so moving on here. So in cancer care, we also have a term called survivorship. And survivorship can be that time where active treatment is done and we've moved on to the rest of our lives outside of active cancer treatment, but more and more survivorship has become a chronic condition because people who have had, or families who have had treatment for cancer, have lasting effect. Remember, going back to that chronic condition definition, things that last more than a year and such. For many, many years, there can be side effects from treatment. Sometimes there is fear associated with follow-up testing or just surveillance kinds of things. There's anxiety that comes with every time we have another scan. We tend to call that scanxiety. Is it back? And things like that. And sometimes survivorship is surviving the loss. And that is where the family, maybe the patient has not either survived cancer, or sometimes we sometimes die with cancer, not from cancer. And so sometimes you just have a family that is left behind for whatever the reason, but there is survivorship and moving forward from there. That is the chronic condition and coping as well.
Okay, so has anyone ever heard new normal? Have you heard the term new normal? We use it a lot in oncology, in cancer care. And we use it at the period where someone is going through treatment or in like this kind of, you know, gray area of survivorship stuff. But new normal is, you've got normal before cancer and the new normal for after cancer. And it's a language that we use to describe changes that we have endured because of cancer and cancer treatment. So it can be body changes in our stamina, maybe energy level that might be lower than it was a little bit before the cancer treatment itself. The problem that we run into when it comes to defining new normal is when people put a value judgment on that themselves, imposed by themselves, where this new normal is somehow worse, right, than the old normal was. But new normal is essentially, I mean, to me it's always kind of been an issue of integrating and accepting the reality that you have dealt with cancer and that you have gone through treatment, and your body and your life may have changed a little bit as a result. As we age, this happens too. When I was in my 20s, I was running for a moment about 5 miles a day. At 52, I don't run at all anymore, right? And so, I mean, things just happen naturally with aging. Cancer, the experience of cancer can feel like it accelerates things a lot and suddenly in our lives, but making peace with the new normal is really kind of where the healing happens after cancer treatment. So, but when people are, if you do a little bit of research online or in books, there's lots written about new normal, because it's really a task of survivorship for people that have come through cancer treatment. So I think Angela here, she's a 57-year-old cancer survivor, and I absolutely love this quote. She says, "From my perspective, treatment never really is over. Over implies you go back to where you were before. The experience and the treatment changes you forever. It changes how you see your life, the world, your relationships with others, your body, and the decisions you make for the rest of your life. It is forever part of your story." I mean, Angela is obviously someone who has accepted and integrated the cancer experience into her life. Sure, her expectation is not to go back to the old normal. It's that things have changed. She's validating things have changed for me as a cancer survivor.
So I think as we talk that, as we look at then what is that new normal, normal may include new ways of coping, establishing boundaries for yourself, recognizing what your boundaries and limitations are. Maybe sometimes it's redefining your priorities, taking a look at things that what we thought were priorities, and sometimes, having a cancer experience helps us to actually kind of reorganize those a little bit. Reconciling what you can and you can't do, and maybe it's a time to find some new things, new skills, new hobbies, new relationships, and finding a peace with new life. Maybe, it's not walking the golf course like you used to, but maybe going to the golf range might be something that you can do. Finding new ways to adapt, and finding grace or compassion for yourself. Not being so hard on yourself, but understanding that, and I think this is true for cancer as well as aging. I know Amy and I both have elderly parents and in-laws, and just, aging is hard. Changes on the body are hard, and whether that's from aging or whether that's from cancer and treatments, we are all every day, we're all living and all dying at the same time. And whatever those causes are, they are unique to us, but for everyone, kind of taking each day and accepting where we're at today, living in the moment, has so much value. And I think sometimes a cancer experience helps us, at least for a short time, really recognize and think about that. One of the important things that I think for quality of life is really recognizing our triggers. Sometimes stories about cancer, billboards, a TV show, upcoming scans and tests really can trigger bad emotions. They can trigger stress, and it might be in ourselves and it might be in those around us. Just literally new aches and pains of, oh my goodness, what is that? Anniversaries. My sister recently said, I had a 1-year anniversary of my cancer diagnosis. That was not an anniversary I was anticipating. Maybe anniversary of surgery, anniversary of the last day of chemo, things like that, but anniversary of the diagnosis. So it's kind of those things that are important spots in time that forever changed our lives maybe, and to be aware of those,
I was going to say that the triggering can take you back to the trauma. For when we talked about the cancer diagnosis, it can take you back, and which is why we just pay attention to those things. And next slide is
So this one here.
discovery. So we started off this by saying, coping is at the heart of the cancer experience. And when we talk about restoring and reestablishing our life after cancer, I think we're talking about being intentional. And when it comes to how we're going to cope, we don't take it lightly any more than we take lightly what medication or treatment a doctor asks that we get. We're also paying attention to what kind of skills we're using. We need to know our coping styles that we went over, tools that you use, follow-up, counseling, support groups, church meditation, just reading up the slide here. All of these things are things you can do to expand your skill set. So being present in the moment. This has more to do with focusing energy on how you really want to, spend your time, which I think cancer, the experience of cancer, kind of really defines that clearly for us. Where prior to a cancer diagnosis, every little thing that happens in your life might make a big difference to you, but with a cancer diagnosis, can really zero in on what's most important to you and to your family. Relaxation techniques. When I say relaxation techniques, I mean real relaxation techniques. Not just like I'm going to try breathing deeply a couple of times. I'm talking about like sitting down and really trying to do things like deep breathing or meditating with intention. There's maybe even through YouTube videos or support groups, we can learn how to do these things to calm our bodies and our minds. Exercise, getting a decent amount of exercise, eating well, following up with your doctors. All of these things can really kind of help us be more present in the moment and spend more focus intentionally, working on our health. So finally, learning how to live with uncertainty.
Whoops. Oh,
She moved my slide.
sorry, I'll go back. Oh, it didn't go
It's
back.
all right. It's all right. At the end of the day, you're...
Oh, there it goes.
Okay.
Oh, there we go.
Learning how to live with uncertainty when what we want most is reassurance, right? I mean, that's what the cancer experience is defined. So finally, I'll let Deb take this.
I'm sorry, Deb got distracted by realizing we have a typo that says you're not alone as opposed to alone.
Yeah.
But, really keeping in mind, we kind of call it the 14 million. So, identifying people, identifying themselves as a cancer survivor, there's 14 million opportunities to talk to others that are living with a similar or same kind of issues. There's 14 million people that have learned how to incorporate these issues into their lives, that can speak from a place of knowing is not always easy. And 14 million people that can understand and would be the first to tell you you're not alone. I think there is so much to coping to that as the community experience, as personal as a cancer diagnosis is, as personal as the issues are and individual to yourself. We were talking just before this started, one of the downsides that's happened as a result of COVID is many of our support groups were put on hold, and the absence that there's a void that leaves because, in just being able to identify with people that, you're not alone, that I've got things that are similar but not the same, being able to talk and share from somebody who knows is so important. So anyway. So we've gone a little bit over on our time here. We do want to give some opportunity, to ask questions. So we thank you for bearing with us on it.